Welcome to the Lunch and Learn at Refined MD. Thank you for attending. To start off, I'd like you all to be able to have a chance to take a quick look at how Emtone works. This is a short video that showcases the mechanism of action of this particular treatment. Take a look.
So working at the gym, I noticed that gray yoga pants is the thing, and I feel like you have to be really bold to wear those pants. You can see every dimple with those pants. I, on the other hand, wear the thick wetsuit style pants, and those are just hot and uncomfortable. Without having cellulite, I would love to wear leggings, the thin ones, not the thick leggings. I work out 5 times minimum a week. And it doesn't matter how much I work out, I can't get rid of the cellulite on my legs and my stomach. I've tried creams, I've tried needling, I've tried massages, and I stuck with it like it says, the 6 to 8 weeks, but nothing works. After using Emtone, you can notice right after the treatment that my skin was tighter and my skin was smoother. It was very easy peasy. After the procedure, you don't have to do anything. You just go on about your day. I love Emtone, and I'm telling all my Fit Fam to try it out. I am empowered by Emtone.
So what is cellulite? Cellulite is the deposition of subcutaneous fat in the fibrous septate network just beneath the surface of the skin that results in puckering and an uneven surface at the layer of the outside layers of the skin. So does Emtone treat severe sagging skin? Sometimes in severe cases, the correct answer is, if it really bothers the patient, to at least do a consult for body surgery. Emtone, the earlier you get started with this as a preventative measure to prevent sagging or prevent laxity, that's better. So younger patients get better results. Older patients, let's say in their late 50s or 60s, need more treatments to accomplish the same results if they're even capable. Because once severe laxity sets in, you're primarily a surgical candidate. So a good candidate for Emtone can be somebody even in their early 30s, if somebody's very aware of the changes in their skin and their body, and they want to address early signs of laxity. However, I would say the majority of our patients are in their 40s and 50s, and they're seeing signs of impending laxity or laxity that's already occurred, as well as cellulite dimples in their thighs, in their posterior thighs, and in their buttocks. So some people can see some results after 1 to 2 treatments. The results they may be experiencing is just some improvement in the quality of the skin and in the degree of laxity that they're observing. Most patients, however, do a series of 4 to 6 treatments in our office, and the optimal results occur 6 weeks after the final treatment. Just like most other body contouring devices, results are not permanent. We continue to age, bodies change, people gain weight, people lose weight, or have differing levels of physical activity. So we do not promise that the results are permanent. However, most of our patients at least have results that benefit them for at least a year period. Patients are eligible for maintenance treatments with this, just like our other body treatments at Refined MD. Emtone has some effect on fat, that's true. That's why we see improvement in the amount of cellulite. However, if patients are looking for circumferential reduction, let's say around the waist, or if they're looking for circumferential reduction around the thighs, Emtone doesn't alone provide that. I think of this more as a body toning, skin improvement device, skin laxity improvement device, not so much reduction. If you couple this with other devices that we have in our office, such as cool sculpting, that kind of pairing of the two treatments would be more likely to provide circumferential reduction. Essentially, there's no downtime associated with an Emtone treatment. Perhaps you have a little pinkness to the skin that lasts about half an hour to an hour after the treatment. That's it. There's no discomfort the following day. So Emtone is a great treatment because it is non-invasive. It's an office-based treatment. This is something that could easily be done on your lunchtime. It's non-painful, kind of feels like a hot stone massage. The pricing structure for Emtone depends on the length of the series purchase, whether it's 4 or 6 treatments. But roughly in our office, patients are paying $2,400 to $2,800 to do a full series to a single area. This, for most people who have experience with other body treatments such as cellulase or other treatments addressing cellulite, like Selfina, is kind of at the lower end of the price spectrum. So you're definitely getting a treatment that is not painful, office-based, non-invasive, more affordable than either Selfina or cellulase. So now let's take a look at the machine. This is Emtone by BTL. You can see there's a kind of a menu-driven system that we can make the settings so that they're customized to your body's issue. The primary settings are the length of time that we do any treatment, the amount of pressure, so that's the amount of physical, mechanical energy, the little like a human jackhammer, if you will, so how hard the pounding sensation is, as well as last is the power, so that this is a setting that regulates the amount of heat that's deposited in the tissue. All this energy is deposited using this handpiece, which is applied directly to your body. Once there's a lubricating lotion on the body part that we're treating. So if we're treating your thighs, we first apply the cream, and then we start moving this in a circular motion, ideally in the direction that lymphatic drainage would normally occur in that area. So we're doing circular motions like this over the whole area. It rapidly heats up the tissue. Your body temperature reaches about 40, 41, 42 degrees Celsius in about the first 60 to 90 seconds. So it's a quick ramp up, and then we maintain that temperature during the duration of the treatment, which is anywhere from 12 to 18 minutes, depending on the body part. So that's it, real simple machine. So now that you've heard of Emtone, let's take a quick look at one of the treatments I did, demonstrating Emtone on an outer thigh. You'll have a chance to see this in person and up close. We're here today with our lovely patient. We're practicing Emtone on her. This is a treatment to reduce laxity in skin, as well as improve the appearance of dimpling. She's chosen to do the back of her thighs and her lower buttocks today. So let's get going and see what the treatment's like. Here we go. Lots of cream. Patient sensation is heat and a little bit of acoustic thumping energy. So we're just going to go in circular motions. Some people say it's important to go in the direction of the lymphatic drainage, but I don't really usually see that happening. So we're going all the way from the area above her knees up to the bottom of her buttocks, and then on the fatty portion of the buttocks. So we're just making small circles. This eventually gets pretty hot to the patient. It's just kind of to the point of saying like, whoa, I need a break. So sometimes I will stop the machine just like that and then continue within 5 seconds. So pretty much to treat an area the size of an iPad, we spend 15 minutes, maybe a little larger than an iPad. We spend 15 to 18 minutes in that area. And just kind of like you're kneading bread dough here. But most patients begin to see an improvement after 2 to 3 treatments. We normally sell packages of 6 treatments of this.
I think in this case, because this patient's laxity is so mild, but she wants to address it early and preventatively, she's chosen to purchase a package of just 4 treatments. So here we go. We're going to work on her lateral aspect of her thighs. Particularly like to get right here, kind of in the medial area here. So all this results in a little tightening, lifting, forming new collagen, breaking up the fibrosepta bands that form collagen. This is a great treatment that we often combine with an injectable called Quo. And Quo is something that's injected just like Botox, specifically into cellulite dimples. This patient doesn't necessarily have those, so she's just doing the Emtone treatment. So this is Emtone again by BTL. Another complementary treatment that we often do with Emtone is something called Emsculpt. And the Emsculpt machine is right behind us here. And Emsculpt is a treatment that treats muscle and builds muscle and kills fat. So that can be nicely combined with Emtone as well. So thank you for attending our event next week. We look forward to seeing you. Just so you know, we have an event coming with the BTL tour bus, which is going to bring various models of equipment, and we're going to demonstrate that. There's a place to RSVP for that event on our Facebook page, so check that out. It's going to be a very popular event next week. Thanks for watching.
So if you have questions about whether or not you're observing laxity, dimpling, and not sure if Emtone or Quo or any other body skin tightening treatment is the right one for you, the best thing to do is to come into Refined MD, schedule a consultation, complimentary, with one of our body specialists, and they'll be able to help you assess the issues going on, help kind of sort out the issues, and make recommendations based on what equipment we have that could help you address those problems.